Diabetes is one of the leading causes of death and disability in the US. But what's the difference between type 1 and type 2 diabetes?
Insulin resistance is the underlying cause of type 2 diabetes and linked to many chronic diseases like heart disease, strokes, and cancer.
What if the very first place diabetes shows itself isn't in a lab result, but on the part of your body you stop looking at after the age of 50? What if the warning signs have already arrived, already settled in, already started doing damage, and the only reason you haven't acted on them is because nobody ever told you what they meant?
Pre-diabetes is when your insulin levels are running so high, but your sugars are still okay because it's just taking a whole lot of insulin.
Today that ends, because in the next 20 minutes I'm going to walk you through 10 signs on your own 2 feet that could be telling you right now that your blood sugar is out of control. And the most unsettling part, most of the people experiencing these signs feel completely fine. I'm Dr. Samuel Hart. I've been practicing internal medicine for over 2 decades. And the majority of my patients today are men and women over the age of 60. And if there is one lesson I have learned in all those years of clinical work, it is this: the body almost always knocks on the door before it kicks it down. The problem is most of us are not listening, or worse, nobody ever taught us what the knocks sound like.
I find that often when people get diagnosed with diabetes, they feel like they have 2 options: either medication or never eating anything they like ever again in their life.
Keep your sugars under control. Now, the day that your sugar goes out of control, you say, oh, your sugars are high now.
Diabetes is one of the loudest knockers in medicine. According to the Centers for Disease Control, more than 38 million Americans are living with diabetes right now, and roughly 1 in 5 of them have absolutely no idea. That is over 8 million people walking around today with rising blood sugar slowly damaging their nerves, their kidneys, their eyesight, and their feet. A simple blood test can detect this for less than the cost of a meal. But before that test ever happens, your feet are already keeping a record. Let me tell you about a patient I'll call Walter. Walter was 69, a retired carpenter, lean, sharp, still mowed his own lawn every Saturday. His wife had been after him for months. Before we drew a single vial of blood, I asked him to take his shoes and socks off. He looked at me like I had asked him to recite the alphabet backwards. Before we drew a single vial of blood, I asked him to take his shoes and socks off. He looked at me like I had asked him to recite the alphabet backwards. But he did it. And in that one short examination, I counted 6 of the 10 signs I am about to share with you. His fasting glucose came back at 226. He had been diabetic for at least 3 years and had no idea. We're going to come back to Walter later, because what he told me at his follow-up appointment is the reason I am making this video today. Now here is how this is going to work. For each of the 10 signs, I will tell you what most people assume it is, what is actually happening at the level of your blood vessels and nerves, and one specific habit you can begin tonight to protect yourself. None of these habits cost $1. Every single one of them is something I recommend to my own patients. Stay with me to the end, because the 10th sign is the one almost no doctor ever points out, and once you see it on yourself, you will not be able to unsee it. Let's begin. Sign number 1, tingling in your toes that comes and goes for no clear reason. Almost every patient I have ever asked about this has felt it, and almost every patient has explained it away. They tell me they sat funny, they crossed their legs too long, they slept on their side. And yes, every now and then, that is exactly what is happening. But when the tingling is showing up several times a week, when it arrives without you doing anything to cause it, your body is sending an early signal. What is happening is this. Excess sugar in the bloodstream slowly erodes the protective coating around your peripheral nerves, the ones farthest from your heart and brain. Your toes are the very end of that nerve network. They are the canary in the coal mine. When that coating begins to break down, the electrical signals running between your brain and your feet start getting scrambled. The result is that pins and needles sensation that comes from nowhere. Doctors call it peripheral neuropathy, and it is the single most common complication of diabetes. Roughly half of all diabetic patients eventually develop it. The habit I want you to start. A 20-minute walk every single day, ideally outdoors, ideally first thing in the morning. Walking is the cheapest, most effective tool we have to keep blood flowing. And start cutting back on sugary drinks today, not next month, today. Sign number 2, a burning feeling in the soles of your feet, especially after the lights go out. This is the one my patients describe as the cruelest because it doesn't bother them when they are busy. It waits. It waits until they are lying in bed, the house is quiet, and there is nothing left to distract them. Then it arrives. They tell me it feels like their feet are sitting on a heating pad that nobody turned off. Here is what is going on. The same nerves we just talked about, the ones being damaged by chronic high glucose, do not always go quiet. Sometimes they go haywire in the opposite direction. They start firing heat signals to your brain. Your brain has no choice but to interpret what it receives. So you feel burning, even though the source of the burning is nerve tissue that has been chemically irritated from the inside out. I describe it to patients like a smoke detector with corroded wiring. There is no smoke, there is no fire, but the alarm is screaming because the sensor itself has been damaged. That alarm is a signal you should never ignore. Studies in major diabetes journals have found that this kind of burning foot pain shows up in patients on average 1 to 3 years before they ever receive a formal diabetes diagnosis. The habit. Drink at least 8 full glasses of water every day and add a serving of fiber to every meal. Fiber slows the rate at which sugar enters your bloodstream, which gives those irritated nerves a chance to calm down rather than being hit with another sugar surge every 2 hours. Sign number 3. A small cut, blister, or scrape that just refuses to heal. This is the one that sends the most patients to the emergency room, and almost every time, it started as something they thought was nothing. A little blister from a new pair of shoes, a nick from clipping a toenail, a scrape from stubbing the foot on a coffee table. They wait, they figure it will close up like cuts always have. Most of the time, for most of their lives, it always has, but not when blood sugar has been quietly elevated for years. When glucose stays high in your blood, 2 things happen at once. First, the small blood vessels that feed your skin begin to narrow and stiffen, which means oxygen and white blood cells cannot reach the wound site fast enough to repair it. Second, the immune cells that should be fighting any bacteria entering through the break in the skin become sluggish and less effective. The wound just sits there, open, waiting for an infection that the body can no longer fight off the way it once did. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Over 100,000 of them every single year. Almost every one of them began as a small wound that a patient dismissed. The habit. Tonight, after you wash your feet, sit down on the edge of the bed and look at them. Top, bottom, between every toe, around the heels. Anything you find that is not closed in 48 hours, call your doctor. Not next week. 48 hours. Sign number 4. Skin around your ankles that has changed color. This sign is sitting in plain sight on millions of people, and most of them walk past it in the mirror every single morning, without ever connecting it to their blood sugar. They notice that the skin around their ankles looks a little darker than it used to, a little more reddish, sometimes a faint bluish or purple tint. They write it off as a tan, as age spots, as something they were born with. Here is what your body is actually telling you. When circulation to the lower legs is compromised, the skin in that area is not getting enough fresh, oxygenated blood. Skin that is starved of oxygen changes color. The shade depends on how long the starvation has been going on and how severe it is. I tell my patients to think of it like a city at the end of a long power line. When the lines get damaged or the load gets too heavy, the lights at the very end of the line are the first to flicker. Your feet are at the end of the longest blood supply line in your entire body. They flicker first. A study published in a leading dermatology journal found that this kind of lower leg skin discoloration shows up on average 18 months before a patient ever gets a formal diabetes diagnosis. The habit. 5 minutes of simple movement first thing every morning. Ankle circles in both directions, 10 gentle toe raises, a few calf stretches against the wall. Sign number 5. Heels that crack no matter how much lotion you use. This sign always surprises my patients the most because most of them have lived with cracking heels for years and assumed it was just dry skin. But when the cracks are deep, when they happen in the middle of summer, when no amount of moisturizer makes any difference, the cause is not in your skin, it is in your nerves. Diabetes affects what doctors call autonomic nerves, the ones that run all the background functions of your body without you having to think about them. One of those functions is regulating moisture in your skin. When those nerves are damaged by years of elevated glucose, the sweat glands in your feet stop working the way they should. The skin loses its ability to keep itself supple from the inside, and no amount of cream applied to the surface can replace what is missing underneath. I have seen patients walk into my office with cracks in their heels deep enough to bleed, telling me they have been faithfully applying lotion for 2 or 3 years. That is not a skincare problem, that is a nervous system signal. And those cracks are not just cosmetic. They are open invitations for bacteria to enter a foot that, as we already discussed, has lost much of its ability to fight infection. The habit. Every single night before bed, moisturize the soles of your feet with a thick lotion or pure coconut oil. Massage it in. But never, ever apply moisturizer between your toes. Trapped moisture in that warm, dark space is the perfect breeding ground for fungal infection. Drink your water during the day too. Skin needs hydration from the inside as much as the outside. I want to pause here for a moment. We are halfway through the list, and I want to ask you something honestly. Have you noticed even one of the first 5 signs in yourself, your spouse, a parent, or a close friend? If the answer is yes, type the word yes in the comment section right now. Just yes, that is all. I read every single comment on this channel, and that one word helps me understand who is watching and what conversations need to happen next. And if you are finding this useful, take 1 second and tap the like button. It costs you nothing, and it pushes this video toward the next person who needs to hear it. Thank you. Now let's keep going. The signs from here on are more serious, and the 10th one in particular is the one I almost never see covered anywhere else. Sign number 6, swelling in your feet and ankles that is starting to feel like the new normal. A little swelling at the end of a long day on your feet is normal. A little puffiness after a long flight is normal. What is not normal is leaving deep sockline indentations on your ankles every single evening, no matter what you did that day. What is not normal is pressing your fingertip into the top of your foot and watching the dent stay there for 10 or 15 seconds before it slowly fills back in. This kind of swelling, which doctors call pitting edema, is your body telling you that fluid is accumulating in places it should not be accumulating. And in adults over 60, especially those with elevated blood sugar, the most common reason this is happening is that the kidneys are starting to struggle. Years of high glucose damages the tiny filters inside your kidneys. As filtration slows down, fluid balance in the rest of the body begins to fail. Gravity does the rest. The fluid pools in the lowest parts of your body, your feet, and your ankles. The National Kidney Foundation reports that about 1 in 3 adults living with diabetes will develop diabetic kidney disease at some point. Lower limb swelling is frequently the very first visible clue. By the time it is severe, the kidney damage is already substantial. The habit. When you sit down in the evening, prop your feet up on a pillow, even just 6 inches above the level of your heart, for 20 minutes. This helps gravity pull the pooled fluid back toward the center of your body where your kidneys can work on it. And start reading the sodium content on every package of food you buy. Most processed food contains far more salt than anyone realizes, and sodium drives the body to retain more water, which makes the swelling worse. Sign number 7, sharp, stabbing, or electric pain in your feet that no painkiller seems to touch. This is the one that gets misdiagnosed more often than any other on this list. My older male patients especially come to me having spent months treating themselves with whatever painkiller they can buy at the drugstore. They tell me they assumed it was arthritis from their working years, an old injury catching up with them, the wear and tear of getting older. Sometimes that is exactly right, but sometimes the pain has nothing to do with their joints or their muscles at all. When chronic high blood sugar damages nerves, those nerves do not always fall silent. Sometimes they go in the opposite direction. They become hyperactive. They fire intense random signals at the brain that get interpreted as severe pain. Patients describe it as an ice pick driving up through the sole, as an electric jolt running across the top of the foot, as a hot needle sliding between 2 toes. It often arrives at night, when there is nothing else competing for the brain's attention. I compare it to a security alarm with damaged wiring. Every few hours it starts shrieking for no reason at all. Nobody is breaking into the building. The alarm itself is broken. Painkillers do not fix damaged wiring. They only mute the noise. And muting the noise is the last thing your body needs you to do when it is trying to tell you something is seriously wrong. The habit. Every morning before your feet hit the floor, spend 3 minutes flexing your feet, rotating your ankles slowly, and gently pulling each toe back toward your shin. Every evening, give your feet a slow, gentle massage with both thumbs along the arch and up toward the ankle. You are not curing nerve damage with a massage. You are increasing blood flow to the area and reducing the firing rate of those overactive nerves. Sign number 8, feet that stay cold no matter what the weather is doing. When I ask older patients about cold feet, almost all of them laugh and say they have had cold feet for as long as they can remember. Their spouse can confirm it. They have been stealing the blankets for 40 years, and usually I laugh with them. But then I ask the follow-up question that matters. Are your feet cold in July? Are they cold under 3 layers of blankets in a heated bedroom? Are they cold even when the rest of your body is comfortable? If the answer is yes to any of those, I take it seriously. Persistently cold feet that do not respond to the temperature of the room around you are a strong indicator that the blood vessels in your lower legs have narrowed or stiffened, to the point where warm blood is no longer reaching the tips of your toes in adequate volume. Your body is essentially turning the heat off at the far end of the building because the pipes can't carry the warmth that far anymore. The American Heart Association estimates that over 8 million Americans have peripheral artery disease, a condition where the arteries in the legs and feet narrow and harden. Diabetes is the single largest risk factor for it. Cold feet that no socks can warm are one of the earliest and most consistent warning signs. The habit, a brisk 30-minute walk every single day, not a slow stroll. A purposeful walk where your arms swing and your breathing deepens. This kind of walking forces blood into the lower legs, strengthens the walls of your arteries, and over time can actually reverse some of the early narrowing that causes cold feet in the first place. If 30 minutes feels like too much, start with 10 and build from there. The most important thing is starting today. Sign number 9. Hair that has quietly disappeared from the tops of your feet and lower legs. This is one that almost no one notices on themselves. Patients sit on my exam table. I roll up the cuffs of their pants to look at their lower legs, and there is a smooth band of skin where there used to be hair. They look down, surprised, and tell me they had never thought about it. That is exactly the problem. It is a quiet sign, easy to miss, and it is a meaningful one. Hair follicles are demanding little structures. They need a steady, reliable supply of blood and oxygen to keep producing hair. When the small blood vessels in your lower legs are damaged by years of elevated blood sugar, those follicles slowly stop receiving what they need. They do not die immediately, they just gradually power down. Over months and years, the hair becomes thinner, then patchy, and eventually it disappears entirely from the area. I describe it to patients as a garden where the irrigation system has slowly clogged. The plants do not wilt overnight, they just stop putting out new growth. The absence of growth is the message. Research published in diabetes-focused journals has confirmed that hair loss on the lower extremities correlates closely with peripheral vascular disease, which is one of the most common complications of long-term high blood sugar. The habit. Right after this video, roll up your pant legs and take a careful look at the skin between your knees and your ankles and the tops of both feet. If the hair on your lower legs is dramatically thinner than the hair on your thighs, or if it has disappeared entirely from the tops of your feet, schedule a fasting glucose test this week. $12 at most labs, covered by Medicare for nearly everyone watching this. $12 is nothing compared to what early detection can save you. Sign number 10. Toenails that have turned thick, yellow, or strangely shaped. And here we are at the 10th sign, the one I told you almost no doctor ever points out, and the one that I want you to pay especially close attention to. Walk through any nursing home in the country, and you will see toenails like this on a significant percentage of the residents. Most people, including too many medical professionals, assume it is just an old person problem. It isn't. It is very often a blood sugar problem in disguise. Here is what is happening. When circulation to the toes is compromised by chronic high glucose, and when the immune system is weakened by the same elevated blood sugar, fungal infections in the toenails become much easier to acquire and much harder to clear. The fungus thrives in tissue that is poorly oxygenated and poorly defended. Over time, the infected nails become thick, brittle, discolored to a yellow or brownish hue, sometimes lifting away from the nail bed, sometimes growing in distorted shapes. Most older adults who notice this assume it is purely cosmetic. They wear closed shoes and stop thinking about it. But thick, infected toenails are not just an appearance issue. They are a visible record of two underlying problems happening at once: poor circulation and a depressed immune response. Both of those are classic markers of unmanaged blood sugar. A study in a major podiatry journal found that patients with chronic toenail fungus were significantly more likely to have undiagnosed prediabetes or diabetes than the general population. The habit. Tonight, look at every toenail on both of your feet. If you see thickening, yellowing white spots lifting at the edge or unusual shape on more than 1 or 2 nails, do 2 things this week. First, schedule that fasting glucose test we just talked about. Second, see a podiatrist for a proper assessment. Treating the fungus alone without addressing the underlying blood sugar problem is like mopping the floor while the faucet is still running. When Walter came back for his follow-up 6 weeks after his diagnosis, his fasting glucose was already down to 148. He had started walking 30 minutes every morning. He had cut sugary drinks out of his life completely. His wife had started reading every food label that came into the house. The burning he had been feeling in his feet at night had eased noticeably. The cracked skin on his heels had begun to soften for the first time in years. He sat across from me in that follow-up appointment and asked me a question I have never forgotten. He said, "Doc, why didn't anyone tell me to take my shoes off 20 years ago?" I did not have a satisfying answer for him. The honest truth is that most physicals are short, most doctors are rushed, and feet are easy to skip. The system is not built to slow down, and look at the signs your body has been quietly leaving for years. But you do not have to wait for a system to slow down for you. You can slow down for yourself. Tonight, before you go to bed, sit down on the edge of your bed, take off your socks, and spend 60 seconds with your own feet. Look at the skin, look at the color, look at the toenails. Run your fingertips over the soles. Feel for numbness, for burning, for any wound that should have healed and hasn't. 60 seconds, that is all I am asking. Let me put this all together for you. We covered 10 signs your feet may be giving you about your blood sugar. Tingling that comes and goes for no reason. Burning in the soles at night. Wounds that will not close. Discoloration around the ankles. Cracked heels that lotion cannot fix. Persistent swelling. Sharp, stabbing nerve pain. Cold feet that no blanket can warm. Hair loss on the lower legs. And thickened, yellowed toenails. Each one is a knock on the door. None of them require a single piece of expensive equipment to spot. All of them are visible to you tonight if you take 60 seconds to look. If you find one of them on yourself, please don't panic. One sign is a question, not a verdict, but it is a question worth taking to your doctor this week. Ask for a fasting glucose test. Ask for a hemoglobin A1C. Both together cost less than a tank of gas, and they can change the entire trajectory of the next 10 years of your life. You work too hard for the years you have ahead of you to let something as manageable as blood sugar quietly take them from you. Catching this early in most cases means managing it through diet, through walking, through small daily choices, not through endless medication and procedures. Late detection is what costs people their toes, their kidneys, their eyesight, and sometimes their lives. Early detection costs almost nothing. If this video gave you something you needed today, please share it on Facebook with someone you love, a spouse, a sibling, a neighbor, an old friend. You may be handing them the one piece of information that they did not know they needed. And if you want more conversations like this one, the kind of conversation I would have with you if you were sitting across from me in an exam room, subscribe to this channel and turn on the bell. I post a new. This video is for informational purposes only and does not constitute medical advice. Please consult your doctor before making any changes to your diet or health routine. Video every week, and the next one is going to cover the 5 breakfast foods that quietly raise blood sugar in adults over 60, even though they are constantly marketed as healthy. I am Dr. Samuel Hart. Take a minute tonight. Take care of those feet. They are the part of your body that has been carrying you the longest, and they deserve to be looked at. I will see you in the next video.